what clients can best benefit from the MagnaWave pulse electromagnetic field therapy? What type of client?
Right, exactly. And so I would say if I were to knock it down into maybe 6 or 7 categories, definitely sports. You got all of the team players before and after, also recovering from an injury faster. If you can get an athlete repaired and back on the field in the shortest amount of time, you're going to be golden as a practitioner. Next one would be car accidents. So again, our whole goal is to eliminate pain and restore function as quickly as possible. So if you could do a 1-2 punch, you do the MagnaWave PEMF therapy, you do an adjustment, and you do that like with your wife, you do a succession of 3 times a week for 3 or 4 weeks along the way, you're going to restore that damaged area faster, and you're going to be able to do that without medication, so there's less toxicity with that. Chiropractors, I would say our main component that we see are low back injuries. People equate low back pain with chiropractors, and to be able to take this and use it over the sacroiliac joints across that 5th lumbar and to wipe out that pain so that the person can actually stand up without pain and sit down without pain. People will walk in looking like the letter S because their spine is just shoved over on one way to get out of pain, and to be able to use that and have them stand up a little bit straighter, that's good. And also old disc surgery injuries, to be able to go, and you got to start out real light with those people, but again, if you can get in there and start getting some blood flow deep inside there, which a deep tissue massage can't do, you have to push through tissue to get to it, and this will get to that tissue without having to go through the tissue and cause further injury to get to the spot. So the next one, of course, would probably be the extremities. So your shoulders, your elbows, your knees, your ankles, all of the people that have repetitive work issues, so RSI, repetitive stress injury people, so carpal tunnel, tennis elbow, any high school injury, the quarterback shoulder issue. In fact, when I got this, I treated every single high school football injury I ever got. I was the first test model on this, and I went, okay, I've been waiting to do this, and so that's what I did, and everything's actually feeling pretty good now. Another one, though, that people don't realize, people with restless leg syndrome. And it's actually a huge industry. There's tons of people that have this, and they're looking for ways to get rid of it. They're doing stretches, they're doing yoga, they're doing Pilates, they're doing chiropractic, they're taking medication. I have a patient that for the last year we've been working on this, and we've had maybe 2 nights a week of success with getting better. And I said, well, let's try this right on that muscle. And we did, and I hadn't seen him in about 5 days, and he came back. He goes, I don't want to jinx this, but that's probably the best that I felt out of everything that we've done. And again, that was just with a single treatment. And I said, well, let's do this a little more frequent. So he's going to be coming in more frequent. And then I would say the last group is geriatric. You've already got frozen, tight, stiff joints that need blood supply. And a lot of my seniors that come in, they're already heavy set, so they don't want to go to the pool. And I tell them pool therapy is the best thing you can do because you're buoyant. So you don't have any stress on the joints, and you can move around, and you get these joints to move. And they would love to do it, but they just, they don't have the time, or they're actually, I think they're more afraid to just go in there with their bathing suit, and they don't like how their body looks.
Yeah, that's hello.
So I said, well, let's try this on your sacrum and on your SI joints. And so getting blood supply into those areas, this device does not warm itself up. There's therapies that'll go in, and as a process is the heating unit for it. This doesn't do it. It like you said, it oxygenates the blood cells. And so they begin to feel a little more warm and movement in there. And we can take joints that are just jammed up really tight and start to, for a better word, moisturize them so that they start to get more supple and rubbery. And there is one woman that I am treating with bladder incontinence, and that's one of the things this has been FDA approved to treat. And she's a very obese individual, and trying to get that signal into the one spot is probably the biggest challenge that I've had. but she's had 3 treatments now, and she keeps coming back. She says, I'm starting to feel a little different.
More in control.
She's not sure what she's feeling, but she's feeling, she's in her 80s. And so she said, I want to keep coming back and trying this out because I've tried everything else and nothing's worked. And she told me, she said, I'm spending a lot of money on Depends, on diapers for seniors. She said, I didn't realize how much those would cost. She said, but I want to get rid of those. And she kind of wants her life back. She says, and also once I'm able to do that, then I can start driving again. So she depended on people driving her around, and she doesn't like wearing Depends. And she told me that. She says, I think I'm ready to go. I go, what do you mean? She goes, I don't want to live my life like this. And so I said, you need to try this out and see what we can do. And now that she's tried it out a couple of times, like I said, you can kind of see she's a little hopeful.
I'm Pat Zemer. Because you're interested in learning more about MagnaWave, click this link below and I'll give you instant access to our video series. Thanks for watching.